This came about over a couple years of prayer. I've been serving as the National Episcopal Advisor to the Catholic Medical Association since 2014. Took over for Bishop Bob Vasha in Santa Rosa. And getting to know the organization and getting to know the docs who lead that organization really has been an exciting thing for me. And it's the Catholic Healthcare Leadership Alliance came out of a lot of discussions about Catholic healthcare, and I've always thought that, especially as a bishop, that our Lord primarily was a teacher and a healer, and so education and healthcare are at the very center of the ministry of Jesus Christ and His Church. And so, since I've been with the Catholic Medical Association, I've seen how important it is for the Church to be very involved in healthcare, and for Christ to be at the center of healthcare. That healthcare delivery has to be something that's Christ-centered and Christ-motivated. So because healthcare has become such a big business and such a complicated and complex business with hospital mergers and all of the legalities of healthcare, the delivery systems, the funding of healthcare, and of course we've lost unfortunately, we've lost the help of our sisters who used to run healthcare, who brought healthcare to this country, and who were at the we owe so much to religious women for what they have done for us, especially in this country, but all over the world. The first hospitals, the first nurses, everything. But unfortunately, we don't have the sisters as we did before. And so it's been basically handed over to the lay faithful, and the lay faithful, Catholic lay faithful, have done a great job. But as a result, I think bishops have, for good or evil, bishops have sort of not been able to be as involved in healthcare as they should be, because in a way, I remember when I was in Denver. Archbishop Chaput assigned me to the hospitals, and just wrapping my head around, we had 3 huge hospital systems, and who do you talk to, where do you go to, and it's just this kind of monster that you just don't know where to begin. And so the idea that the bishop does have a role in the healthcare ministry, and he has to exercise that as a shepherd, that was part of the impetus for forming this alliance. And then a document came out in 2020, and I helped on the drafting committee of this document from the U.S. bishops, and it's the pastoral role of bishops in healthcare ministry. And it's a very important document. It was a revision of a document of 1997. And it really spells out and delineates the role that the bishop has, just like he has overseeing education, in his diocese, and all the other apostolates. And so the bishop has a responsibility before God, to make sure that Christ is at the very center of healthcare. So that's sort of a long-winded introduction, but what happened was we came together to form the alliance at the March for Life last January, not knowing that Roe v. Wade was about to fall, hoping, praying, but anyway, so we got together and we brought together the best in medicine, bioethics, law, advocacy, and litigation to form an alliance to help sort of be a one-stop shop for bishops, but also for anybody in healthcare who are looking to understand the ethical side of healthcare, the business side, the legal side, the political side, all these sides. To help be sort of you might say, a voice, a unified voice, a think tank, a place where people can go to kind of, make their way through this huge area we call Catholic healthcare systems. So that was really the birth, the launch of the Catholic Healthcare Leadership Alliance. We've got an Episcopal board of 20 bishops who are our Episcopal advisors for the because we realize it has to be with the church and in the church. And we are going to be doing a series of different kind of education, webinars, all kinds of things planned for the future.
When it comes right down to it, what should be the difference between Catholic healthcare and secular healthcare?
I think that's a very good question. I think it's the anthropology. Who do we see the human person as? And we see a child of God, a son or a daughter of the Father who has an immortal soul, who is called to holiness, and then deserves, because of the sanctity and dignity of human life, deserves to be cared for as Christ would be, as Christ himself would care for them, to love them and to heal them and to bring them they're not just, there's a certain kind of love and a respect, knowing the dignity of the human person, that healthcare should be all about. And it already is in many ways, and it has been for a long time, but to bring Christ back to the center of that's really what the purpose of, or to try to do that, in a more intentional way.
And what do you see as the biggest threat to Catholic healthcare today?
I think the biggest threat is the secularization of our world in which we live, that it doesn't understand or see the value of the immortal soul, doesn't see with supernatural eyes, that we are destined for heaven and that we have a dignity given to us by God. We are creatures of a Creator who has created us in a certain way. Male and female, He created them. The understanding that our gender is given to us by God, and it is to be respected, that God doesn't make mistakes, that He creates us in His own image. And so I think that's a threat. Of course, as John Paul II would say, the culture of death, whether it be abortion, euthanasia, and everything in between, those are all threats to healthcare. And so there's a lot of threats. I mean, we could kind of go through the whole thing, and I think that's. But I think it boils down to a proper Christian anthropology, to see the person in front of you, the patient, the person who's sick, as an image of Christ. To see Christ, see the face of Christ in every person who comes in need of healing, and we're all in need of healing. We're all wounded, and we all need to heal, and especially those who are professional healers. Have to see with the eyes of Christ and with the lens of the Church and her whole body of teaching about the nature of the human person, the dignity, the rights of the human person, reproductive health, all that kind of thing, from the lens of the Church.